Welcome to another episode of Positive Solutions for Life. Today's guest is Angie Nichols. Angie is an educator, author, women's health advocate, and has been a registered nurse for over 30 years. In 2015, Angie became a member of an elite group of practitioners certified in advanced bioidentical hormone replacement therapy through Worldlink Medical. Angie has a passion for and an expertise in women's health with a focus on menopause, PCOS, and sexual health. Together with her husband, Dr. Keith Nichols, they created Tier 1 Health and Wellness with a commitment to evidence-based medicine. Their primary goal is the prevention of chronic diseases, as well as improving physical, mental, and sexual health throughout the aging process. Welcome to the podcast, Angie.
Well, thank you very much. I'm happy to be here. Thanks for having me.
You're welcome. I'm looking forward to our conversation on menopause and hormone replacement therapy today. But first, can you start the conversation by sharing just a little bit more about your personal journey or just the journey to how it has led you to where you are today?
Well, my personal journey with hormone therapy began when I was about 36. I'm 53 now. And so when I was 36, I started noticing fatigue that wasn't quite normal for me, and also an irritability that was not normal for me. And so I decided I would go talk to my gynecologist about it to see, if something might be going on, maybe he could give me some guidance or some help. And he was very candid with his explanation. And he said, Angie, everything that you're explaining to me right now is hormone related, but I don't have time to learn all of that hormone stuff. I'm busy delivering babies and performing hysterectomies, and there's just too much involved in hormones. And I appreciated his honesty, but I thought if you can't get good, solid information from your gynecologist about female hormones, who in the world do you go to? So that sort of began my quest for learning more about hormones. It was really out of necessity to help myself. And so I started attending courses and learning as much as I could, just really so that I could improve how I was feeling at the moment. Now, the more that I learned about hormones and the long-term health benefits that they provide, then the focus really became about trying to age as strong, age as healthy, and delay degenerative disease as possible. I worked in healthcare in the clinic or a hospital pretty much. It's when you said 30 years, I'm like, wow. It's really for about 35 years now that I've had worked in a clinical setting, seeing people, in the throes of really devastating disease, and it was robbing them of a good quality of life. And I just thought, I don't want to end up like that.
Mhm,
So what can I do to delay that
mhm.
or prevent it? And hormones really are so important in being able to do that. There's some things that are beyond our control, but if we combined hormone therapy with healthy nutrition, adequate exercise, and of course, other lifestyle factors, stress reduction, adequate sleep,
Mhm.
then we can dramatically affect or influence how we are going to age. And so we continued to learn more. My husband sort of had the same journey of his own. We started attending courses together and learning as much as we could. And once we started feeling better, the people around us would notice and they would ask, what's going on? What are y'all doing? Something seems different.
Mhm.
And so we really started treating our friends and colleagues just alongside of his spine and sports practice. But it was never anything that we really intended to do as a primary practice. It
Mhm.
was just sort of a passion that we had.
Mhm.
And so it just sort of snowballed from that. Once our friends and colleagues started feeling better, they would ask if we would see their friends or their family members. And then we would see them. And then it just started growing from there until ultimately in 2019, Keith retired from practicing spine and sports medicine to full-time preventive medicine, specializing in hormone therapy. So we started the practice in 2011, but went full-time for him in 2019. And then, of course, COVID hit. And so everything at that point went via telemedicine. So we're located in Chattanooga, Tennessee. And it's just really all that we do. We eat, breathe, sleep, live it.
There's so much to hormones. I mean, we as women are just like, oh, there's so much, and with our menstrual cycle and stuff, like throwing us off balance, you like every month. I mean, I it's just kind of a complicated, scenario for us. But as we like focus in on menopause, can you give us a like clarification on what is menopause and what is menopause? So perimenopause and menopause, what are they and what's the difference?
Okay, so you're so right. It is very complicated. Men and hormones, it's super easy.
Hmm.
For women, it's hard because there's various stages. Like you said, there's pre-menopause, perimenopause, and then menopause. And then there's also, you have to factor in, menstrual cycles and then maybe PCOS. And we have more hormones to manage than men.
Hmm.
And so it is much more complex. So you have to look at the stage that a woman is in. Perimenopause is the time that leads up to menopause. So your ovaries are still functioning during perimenopause. Perimenopause can be as much as 8 to 10 years before you actually go through menopause. Menopause is defined as no menstrual cycle for 1 year. Or in the cases of women that have had, hysterectomies or uterine ablations, and we don't really know are the ovaries functioning or not, then we have to look at other diagnostic tests. And other things can put women into menopause prematurely. It can be stress related. It could be chemo, radiation, smoking. There's other things that can, cause that to happen earlier. But perimenopause, anything goes, anything can happen. It is the most challenging time hormonally in a woman's life because you really can't control the hormones. You can do some things that make it easier,
Hmm.
but at that point, your estrogen, the ovaries are going to do what they're going to do. There are certain times of the month your estrogen is going to be through the roof, and then there's other times of the month that it's going to be low. We
Hmm.
would never want to give women estrogen that are perimenopausal. As long as you're making estrogen, you don't need to take additional estrogen. There are other things that we can do to control, like what can happen in perimenopause, like hot flashes. Cycles can become more regular. They can become more frequent, less frequent, heavier, lighter, any combination of any of those. PMS can become worse. Headaches are something that frequently will begin to happen. And all of the negatives really that happen during perimenopause is the result of estrogen levels being really high without an adequate amount of progesterone to oppose the estrogen. So it's really important. They work hand in hand.
Hmm.
So estradiol, when I say estrogen, I'm meaning estradiol. Estradiol is the healthy, forever safe hormone that our body makes naturally on its own. When we treat a woman in menopause, we would always use bioidentical estradiol because anytime that you can replicate what nature gives you, you get a better result with fewer side effects. So, but in perimenopause, the focus is about raising the progesterone adequately to oppose the unwanted effects of estradiol.
Right. Yeah, that just seemed like I'm just like my brain is swimming because it just seems so complicated and anything goes. I think that's the most difficult part for people to understand is they want, like, at least for me, I wanted simple things like, okay, you know, my period's gonna be less, it's gonna be less free, but it's a widespread. It could be one way or the other, and it can change
Absolutely.
month to month, 6 months, 6 months, whatever the time frame is. So what kind of advice do you give somebody that's going through perimenopause or maybe it's more so giving advice to their significant others or their family members?
That's a good point that you bring up because it does affect every person that the woman interacts with, whether it's her children, whether it's her spouse, friends, coworkers. And it's important that there is a conversation about what's going on. For so many years, there's such a stigma around hormones in women, and they don't want to talk about it. And it's kind of like, you hear whispers of it, and everybody talks in low voices about it, but it should be something that we talk about so that there is greater understanding, so that, your family members and your friends kind of know what's going on, and, you're not losing it. It's just a period of life that we go through sometimes, and we can't really stop things completely, but we can manage it. And
Mhm.
so The way we manage is with progesterone. So my advice would be talk about it to the people that you love and that you're around, and then also keep a lot of progesterone on hand, ready and available, because that opposes all of the unwanted effects
Mhm.
of estrogen, like think PMS type symptoms,
Mhm.
breast tenderness, bloating, irritability, pelvic cramps, those heavy cycles that come. Progesterone won't stop your cycle, but it will reduce the buildup of the uterine lining, and so you'll have less heavy periods. That was another one for me during that time, was my cycles became really heavy and regular, more frequently. And, of course, I didn't have a provider at the time that said, you really need a lot of progesterone. This is going to help.
Mhm.
So they tried some different things. They tried birth control pills. That didn't really work. They did a uterine ablation, and that took care of the problem. But really, had I just been given progesterone,
Mm.
then it probably would have managed it without me having to have that surgery.
Mhm. Mhm.
So, but sometimes that can be ineffective with women that have just really heavy cycles, and if it's interfering with the quality of life and the progesterone isn't doing it, which I really haven't seen that happen. It's just usually when women aren't given enough progesterone, then it doesn't fix it. Of course, you have to have an adequate amount of each of
Yeah.
the hormones. But yeah, it's a hard transition for women.
Yeah. Yeah.
Mm.
So you're talking a lot about progesterone. Like, what other kind of treatments are there, I guess, for hormone therapy? I mean, let's start a conversation on hormone therapy, and where do you want to start with that as far as introducing that?
So are you talking about premenopause or are we talking about menopause?
Well,
Because
let's
hormones are going to be
yeah,
totally different in how
right.
we approach it.
Okay.
Um,
So
if
start with peri, I guess, and then move into menopause.
Okay, so with perimenopause, as we age, all of the hormone production begins to decline. So we can look at some of the other things around the time that women start experiencing perimenopausal symptoms. They'll often also see a decline in thyroid levels. Even though the thyroid levels may come back normal on a lab sheet, they still start to decline. And it's more about, is the patient symptomatic as opposed to really what the numbers are. We look at those baseline levels so that we see, is it appropriate to start someone on hormone therapy, or where are they, just so we have a good baseline. And then we measure it monthly until we get it in an optimal range and symptoms are resolved. And this allows us to see, how did the patient respond to what was prescribed. So, but we also look at thyroid, because when you lose thyroid, it affects your metabolism, which affects your ability to lose weight. It causes an increase in fatigue. It can cause an increase in cholesterol levels. There are 200 different symptoms related to thyroid deficiency. You see an increase in depression, an increase in patients complaining of mental fogginess, just not as sharp. I heard a really surprising statistic recently, that this was a UK study, that 1 in 5 women during the perimenopausal, menopausal timeframe, 1 in 5 women quit their job because they don't feel that they can perform the job adequately anymore, because their mental clarity is just not there. And I thought that was really surprising.
Mhm.
But when you think about it, it makes perfect sense.
Yeah, yeah. With all that, with all those symptoms of just mental fogginess and just fatigue and just worn down and
Yes,
all of that, it all affects different areas of our life.
absolutely. It's also important to talk about testosterone in women. We start losing testosterone also around that time frame. And when you lose testosterone, you start to lose interest in sex.
Mhm.
You will start to, again, it plays into your ability to be able to lose weight, because testosterone lowers insulin resistance. And so, or increases rather, insulin resistance. And when you're resistant to insulin, it's much more harder for you
Mhm.
to lose weight.
Mhm.
Testosterone also lowers cholesterol levels. It's cardioprotective. It has been approved by the FDA to treat breast cancer. There are so many benefits of testosterone, and most providers never educate their patients about that.
Mhm.
Even most women, they think, oh, testosterone, that's a male hormone, but
Mhm.
it's actually our most abundant hormone
Mhm.
before we go through menopause. So during the reproductive years, we have a lot of testosterone. It helps with strength. endurance, your ability to build lean muscle. So a lot of times we'll hear patients complain, well, I work out all the time, but I just don't see any results.
Mhm.
That's why it's a loss of testosterone. It can also be a loss of thyroid. There's all the hormones are, you know, the key to how our body feels and functions. We were designed to have them. And when we lose them, we do not feel the way that we were designed,
Yeah. Yeah.
function the way that we're designed to.
Exactly. Exactly. So how do you know, like, if you would need hormone replacement therapy?
Well, most of the time women know because they're just feeling unlike themselves.
Mhm.
They start noticing an increase in all of these symptoms. They lose interest in the things that normally interest them. They're more fatigued. They're gaining weight. Their PMS symptoms are worse. The menstrual cycles are more irregular. And so that's usually why people come to us is they can see, they know. Unfortunately, a lot of times when patients go to their primary care provider or their gynecologist and they voice these concerns, a lot of times women are given bad advice and they'll tell them, well, we're just getting older. This is what happens. You just have to, deal with it best you can. It'll pass. Um, but we really don't have to accept it. There are so many other things that we can do now to improve the quality of our life.
Mhm.
And, everything that we do is evidence-based, which means it's been proven in the literature to be safe and effective. And, we do this ourselves. So it's not just about feeling and functioning better now, but that's why most people initially come.
Mhm.
But it's really about that long-term prevention
Mhm.
and trying to preserve the best quality of health for as long as we can. And hormones are key to that. When women start to lose their hormones, they notice not only a physical decline, but the mental decline that we talk about. And then, of course, once you go through menopause, the ovaries are no longer functioning. You're not producing estrogen, you're not producing testosterone, and you're not producing progesterone. So it's not uncommon when we do levels on a postmenopausal woman that it'll be too low to measure. Estradiol, testosterone, progesterone, too low to measure. And of course, if we don't have those hormones, we don't get to reap the benefits of those hormones, which is a better quality of health. And a lot of the symptoms of menopause will sort of overlap with perimenopause, and that's why sometimes it's confusing, especially if someone has had a partial hysterectomy or an ablation. They want to know, well, am I really menopausal or is this perimenopause or what's going on?
Mhm.
There's some lab tests that we can look at that gives us more clues into that. We'll look at an FSH, an LH. We can look at an estradiol level, but if they're not really menopausal, half the days of the month it'll be low, half the days of the month it'll be high.
Mhm.
So the FSH and LH is good. You also have to take a really good history and see what's going on, what type of symptoms are they having right now. The average age of menopause in the United States is 51, with the range being anywhere between 45 and 55. And so even though the symptoms can be the same, the way that we treat it is very different. So a perimenopausal hot flash is because you're having a really high level of estrogen and you don't have enough progesterone to oppose it. In postmenopause or in menopause, the hot flash is due to zero estrogen. So of course, in that case, we would want to give estrogen to stop the hot flashes. So
Mhm.
we treat it differently. And that's another reason that it's difficult for providers sometimes. They don't get this type of education in medical school, which is kind of shocking. You
Mhm.
would think that that is something that's taught, but it's really not. If doctors want this type, or any practitioner wants this type of training, they have to go out and get it in addition to what
Mhm.
they get for their training for licensure.
Yeah. So I would like to, I know there's a lot of like different treatment things out there. So, you talk about hormone replacement therapy, there's like testosterone, there's bioidentical hormone replacement, and there's also probably some more natural things or lifestyle improvements that could all play a part. And I know, talking about it, sleep, exercise, health, all of that can play a part. You're talking a lot about testing the hormones and really, that's really what we need to test in order to be able to measure, to be able to do the next steps. But for those that don't really know the difference between some of the hormone replacement therapies, whether it's testosterone or bioidentical, can you shed a little bit of light on that and separate them out a little bit?
So for us and what we do in our practice, we're a comprehensive program. So we include testosterone in bioidentical hormone replacement therapy. And so that's just a part of what we do in that. There are some, I guess, traditional medicine that you can look at where they give estrogen, but the tide is starting to change a little bit. It used to be always that if you went to a primary care provider and you were needing help with hot flashes and going through the menopausal transition, they would give you Premarin, which is 10% estradiol and several different equine estrogens. So the estrogenicity or potency of a horse estrogen is a lot stronger than what the human body produces on its own. And so whenever you start taking things like that, with the chemical structure altered, you start to get some unwanted effects. So I would never recommend that. We never use that Premarin, but it is still used today. But we use 100% estradiol, and that's what our bodies make on its own. So that's what we, for a menopausal woman. But again, if you're not in menopause, you definitely don't need it yet. And so there's also testosterone, but you know, a lot of these things like now the progesterone, there is commercially available through your regular pharmacy or your primary care provider. It's called Prometrium, which is a bioidentical progesterone. And so we use a compounded micronized progesterone because we can get a more potent product, which is going to raise the level more cost effectively and than what the commercially available pills are. So what's commercially available is a 1 or 200 milligram tablet. The problem with the tablets are you don't absorb them as well. So it doesn't raise your levels to a therapeutic range as quickly or as well as, say, a sublingual troche, which is a little round waxy disc that you place under your tongue, let it dissolve. You absorb almost 100% of that. So it raises levels really well, than much better than the capsule. Also with a troche, it doesn't make you sleepy as long as you don't drink liquids for an hour after you dissolve the troche. Anytime you swallow progesterone, it will make you sleepy. So with progesterone capsules, you're limited to bedtime only. And then you're also not absorbing it as well. So it has its limitations. We do use it sometimes in women that have issues sleeping because it will help cause drowsiness and help them sleep a little better. But for women that have migraine headaches, that have a lot of PMS symptoms, that have anxiety, I don't want them to wait until bedtime to get relief of those symptoms. I would prefer them to take a troche as soon as they start to experience it so that they get relief sooner. Usually you'll start to see a sense of calm. Everything kind of calms down after about 30-45 minutes of dissolving a troche under the tongue. So with what we do, it's comprehensive. We're looking at everything. DHEA, melatonin, pregnenolone, we look at it all.
So what you're really talking about is optimizing like hormones.
Right.
So what are some of the benefits of that?
Gosh, there are so many. We could talk for a long time about the benefits of hormone therapy. So just for instance, let's talk about testosterone. It's cardioprotective. It lowers your bad cholesterol. It lowers insulin resistance, so it can reduce your risk of type 2 diabetes. It also is a vasodilator, so it opens up blood vessels and helps to reduce blood pressure. A lot of our patients are able to come off of antihypertensives or statins for cholesterol after they've been on testosterone for about a year. So there's a lot of cardiovascular benefits of testosterone. Testosterone also increases collagen production in your skin. So you notice less wrinkling and sagging of the skin. It helps to promote confidence. It helps with decision making. There are just so many benefits. It reduces the risk of breast cancer or can actually treat breast cancer very effectively. So that's just testosterone. For say estradiol in a postmenopausal woman or woman, you start seeing when you lose your estrogen, your bones start to deteriorate and you develop osteoporosis. It's a major killer of women. 40 to 50% of women will die within 2 years of a hip fracture, and it's totally preventable. We just have to maintain our estrogen, progesterone, testosterone. So the benefits of estrogen are increased bone mineral density. It also has a positive effect on the vasculature. It relaxes it so that it also reduces blood pressure. It helps to reduce visceral body fat, which is the fat that accumulates around the midsection. You know, women, when they're perimenopausal and they're younger, they carry their weight in their hips, thighs, and buttocks. But as you age, there's a shift in body fat distribution, and so women turn into more of an apple shape rather than a pear shape. And it's that visceral fat that accumulates around the midsection that's the really dangerous, unhealthy fat that increases inflammation. So estrogen helps to reduce all of that. It also helps with reducing urogenital atrophy and helping to reduce urinary infections, which can have a devastating effect. Women that are older, you know, in the nursing homes, you've probably heard of women that developed UTIs and they just couldn't get rid of them, and it eventually develops into sepsis and they pass away. And a lot of that could be prevented just by maintaining estradiol. So it also helps with mental clarity. It helps to reduce depression. There's just so many things that it will help with. That macular degeneration, vaginal dryness, which when you are experiencing vaginal dryness, then you start to, you know, want to avoid intercourse or intimate contact with your partner, which can then have a negative effect on relationships. Pretty much every aspect of your life, estrogen is going to improve it physically. So we need it. We don't ever need to be without it.
Yeah. I mean, I'm just listening to your, like, all the benefits of it. And it's like, oh my gosh, why don't we, not enough of us know about it. So I'm glad you're here today to shed some light on this, and hopefully the listeners can share this to be able to, impact more people's lives, because what I'm hearing is optimizing the aging process. Like, I don't want to, I feel like the best years are yet to come. It's been a struggle with motherhood, through many years. And it's just like, okay, now I want to enjoy this time, but I don't want to spend it not feeling well. So optimizing our hormones can really create new life in us after the kids are out of the house.
Absolutely, in so many ways. And it's not just, I mean, it's for every woman. The age does not matter. We've got patients in their 80s that are on hormone therapy and new to hormone therapy and now have a completely new lease on life. And, even in the 60s, 70s and beyond, will say, I can't believe I feel this way at this age. I can't believe that I'm having an active sex life again. I thought that part of my life was over. And they were happy with feeling that it was over, really. I've been shocked at some of the stories that women have told me over the years. They want to stay married, they love their husband, but they don't want any sort of physical relationship with him. And it's because of that loss of estrogen, and they get that back, and then they're calling me, telling me what a honeymoon phase they're in right now, and things are great, and they've never felt closer to their spouse, and so that's really important.
Yeah.
A healthy person is a sexual person. And so if women start to see that is declining, then they really should take a look at it and be, okay, well, what is going on?
Right.
Yeah.
Gosh, there's so much here, and I know there's so much more information we could share, but I want to honor both, you and your time. And is there a way that listeners can find out a little bit more about Tier 1 health and wellness, what you do?
Sure. You can go to our website. It's www.tier1hw.com. You can Google Tier 1 Health and Wellness. We have a YouTube channel, Facebook, all the social media things, Instagram, and so you can check that out there. We put a lot of educational information out there because we want people to know, I really want women to know that they don't have to settle or suffer through perimenopause or menopause, and that you really can take control of the quality of your health long term. You just have to become an active participant in it and become your own best advocate.
Mhm.
So we get a lot of, free educational information out there. If you don't get it from us, get it from someone, but make sure that you educate yourself so that if you go somewhere and they're trying to tell you to do something that is not in your best interest, that you will know. And so I think education is key. We used to just be able to go to the doctor and they would give us what we needed and we never had to question things.
Mhm.
But with hormones, they don't get the teaching or training and don't have the knowledge. And it's not their fault. They just aren't taught it in medical school. And prevention is not taught, whether it's nutrition,
Right.
hormones, it's just they get very little education. Medicine is really all about treatment
Mhm.
rather than prevention. And so we have to be our own best advocate.
Definitely, definitely. Thank you for that.
Yeah.
And is there, as we wrap up today, is there anything else that you would like to share that maybe we hadn't touched or that you really feel like the listeners need to hear right now?
So it's the most common endocrine disorder among reproductive age women. It's most commonly missed, though, reproductive issue that women have, and that is PCOS, polycystic ovarian syndrome. And we're seeing more and more of these cases, and a lot of it has to do with the endocrine disrupting chemicals that are in our environment, preservatives in our foods, the phthalates, and all the things that we're exposed to in our environment. And so I think that's something that younger women, especially in the reproductive age, if they're having a lot of irregular cycles, a lot of PMS type symptoms, a lot of mood instability, do a little research on that, because if it's addressed early, it can dramatically change the course of their life long term.
Mm.
So that's a really great topic that every woman should be aware of, but very few actually know about it.
Awesome. And I'm sure that there's some information on your website or something,
There it is.
information that listeners can go to find out a little bit more about that.
Yes, they sure can.
Awesome. Well, thank you so much for joining me today, Angie. This has
Oh, you're
been
so
a
welcome. It's been my pleasure.
very, very informative, and I hope the listeners found some gems that they can take away.
Me too. Thank you so much.
Thank you.